Hi, Dr. Ahadian here. The issue today is regarding the post-traumatic stress disorder and the new developments with regard to the research that has been done. And that basically goes as such that in the researches that has been done with regard to post-traumatic stress disorder, which is a situation when the person is exposed to severe trauma, it's been seen that if there is a severe trauma that an individual is exposed to in childhood, then the sequelae and the effect of that would stay in the brain system, and in the future, and if there is a catastrophic event, there will be the repercussion and revisiting of the symptoms that the person felt when they were a child going through the severe trauma. For example, if someone gets severely traumatized by rape, by death, by histories of severe abuse in childhood, then they've researched the situation with regard to the 9/11 September 11 attack, which ended up to the Twin Towers being destroyed, and as such, that those people who've had this traumatic effect in their childhood, after seeing this effect, that this news that happened, began to experience the feelings of severe trauma that they felt in childhood with regard to fugue state, the state that somebody wants to run away, the memories of the incident that they were in as far as the sexual abuse or rape or severe abuses or gunshots, or experiencing the war symptoms in people, in veterans. And then the interesting part about that is, again, it's just a bit of news, but it's how interesting it is that the brain system and its memories that get ingrained in it begin to reenact and resurface with something unrelated, however, to the same intensity that the person has felt in their childhood. And then again, we could imagine how these associations and all this information would be helpful in therapeutic intervention, in medication treatment, in treatment of the post-traumatic stress disorder with different kind of medication, especially lately with usage of propranolol, which is a beta blocker. That there has been a research that using this medication after the trauma, after someone who's been exposed to a trauma, could help to decrease the intensity of the memory of that trauma, and therefore decreasing the effects of the post-traumatic stress condition. I will discuss that again later in different occasions. Thanks.